We're spending some time with Dr. Stephen Marsh here in his office, and his practice is also known as Cleveland Smiles. They're known for putting smiles on a lot of people throughout Northeast Ohio and beyond.
Thanks so much, Joe.
Well, we talk about sometimes people that want something done just with their uppers, sometimes just with their lowers, sometimes the whole mouth.
Yeah, and we really try to respond to whatever a patient wants. Oftentimes, dentists, I think, judge people on when they came in. And one of the things, we sit down around the table to find out what's important to them. We know what we can do, but it's a question of what they can do, maybe time, finances, all those things play a role, and we want to be very responsive to that.
And sometimes it's a process. Maybe the uppers start first, down the line, go with the lowers.
Right, and we usually start with the uppers, as a matter of fact, because it gives us a smile line. That's what people see every day.
Right.
And then later on we can build the lower, and some people want to do it all at once, and I have some people say, can we do it in stages, maybe because of finances or time, so whatever works for them.
Well, let's take us on some journeys, all right? Let's start with Leanne.
So Leanne was actually kind enough to write us a note about how much it meant to her.
Very good. In fact, I have the actual handwritten note right here. It says, Dr. Marsh and staff, words are simply not enough to express the depth of gratitude that I have for you and your whole team. With each and every one of you, thank you so much for giving me a smile that I can be proud of. You guys are the best. That has got to be the best for you.
It's very
got to warm your
special.
heart.
Yeah, because we always try to get the result that the patient wants. But when we get those notes and cards like you just pointed out, it means a lot to not just me, but our team, the artwork that's done at the lab. It all comes together.
Yeah, and you say artwork because it is a work of art.
It's very much an art.
Let's see Leanne. Let's see how she started.
Okay, so this is how Leanne started. And she had looked at having dental work done before. She had a lot of bonding done, a lot of reshaping.
Oh, yeah, you can kind of see, yeah.
And she finally said to me, no, I really want to take care of my teeth. This is the time for me. Her kids are raised. And we hear that a lot.
Sure.
So, Joe, we started in the upper arch, as you and I just discussed. We did actually 12 teeth on her, gave her the smile that she loved. And actually, she loved it so much, she said, when can we get started with the bottom? She had thought it was going to take more time. We came back and did, on the lower fronts, Joe, we did 6 veneers. In the back, she had some fillings. We did some crowns and gave her that smile that she was so thankful for.
Now we see Karen. Wow, Karen really had a whole transformation.
Yeah, and Karen's issue was that over time her teeth had moved, and like so many parents, she took care of her kids, and now she said, it's my turn again to take care of myself. We looked at options. She said, I don't want to go through braces. I don't want to go through any of those aligners. Let's do it as quickly as we can. So, Joe, we did a plan for her. We did her 10 uppers. As soon as she was done, we reshaped the lowers. She said, let's do the lowers as well.
Beautiful.
But again, that's what the patient wanted. Lauren was a very interesting case. She fell when she was 14. Broke her teeth, and if you will, the oral surgeon tried to splint those together.
Oh, wow.
It worked for a while, and unfortunately, because of the damage done to her teeth, she actually lost those teeth, lost a lot of bone along the way. And Joe, just recently, we actually did a bridge on her. It's called zirconium on the upper. Her lowers we reshaped for now. We may get to the lowers to give her that beautiful smile. And lastly, Andrew. And Andrew was in his 50s. He wanted to go out with people again, date women. He's a big hockey fan, big sports fan.
Wow.
And he said, I really need to do my teeth. His daughter encouraged him. She's actually a dental student as it is. And we actually did all his uppers, all his lowers with a combination of different kinds of porcelain to give him the smile that he said, I'm very confident, and I can go to hockey games and feel good about myself.
The best looking smile in the whole place. Well, if you want a smile remade, whether it's some, most, or all your teeth, please give Dr. Marsh and his team a call at 440-461-1003 or log on to their website, clevelandsmiles.com.